Christie. I'm critiquing your second HAFA video. I liked how you checked the patient's chart. You talked about hand hygiene. You provided for privacy, introduced yourself to the patient. You identified the patient by asking for her name and date of birth. You explained the procedure to the patient, which was good. You asked about respiratory illnesses and diseases, shortness of breath, and I thought you might have said pain when breathing, but you didn't ask if the patient has a smoking history, cough, trauma, or surgery, and you didn't ask about medications for breathing, exposure to hazards, or self-care. I noticed that you started at the front. You didn't inspect the patient's facial expression or use of accessory muscles or signs of respiratory distress. You palpated the skin and said skin is moist, warm, and tan, no cyanosis. You said no crepitus, but you're supposed to check this at the back. And you also noted that there was no pallor, which was good. You started percussing at the second intercostal space, that was good, but you didn't note the sounds that were heard while percussing. You auscultated the anterior chest lung field and stated that the lung sounds were clear, there was no wheezing, crackles, or rhonchi, and you asked about pain after auscultating, and that was good. For the back, you checked the AP diameter and stated that it was 1 to 2, and that was good. You skipped inspecting the skin color and condition and palpating the chest wall for temperature, moisture, tenderness, and lesions. You went to percussing, but didn't note the sounds that were heard. You auscultated after percussing and stated that lung sounds were clear bilaterally for the posterior, no wheezing, crackles, or rhonchi, and that was good. I couldn't see where you put your hands for the symmetric expansion, but I thought it was good that you stated it was symmetric both while the patient inhaled and exhaled. And while checking tactile fremitus, I couldn't see where you put your hands, but I also thought it was good that you asked the patient to say 99. And you noted vibrations at top and went down for tactile fremitus. And just remember that when leaving the patient's room, you would perform hand hygiene and clean stethoscope. And you usually wouldn't listen over close. I hope that this helps you, Christie, and I hope